Australian Health Promotion Association, the Victorian and Tasmanian branch, and we are very pleased to be able to present to you today a professional development session on climate change and health. And this is certainly the topic of, gosh, what can I say? The topic of the week, the topic of the century, the topic of our times. We know that we have the Glasgow Summit coming up in a couple of weeks, and we know that our politicians are keenly debating this issue of climate change. We also know that health promoters have been at the forefront of action on climate change for a long time in many capacity and at all scales. So this professional development is a way of reaffirming the work that we do as health promoters, as well as exploring the potential for this field, and to give some language, some technical terms to the work that we can do and are doing. We've got a wonderful lineup of speakers, and I'm so happy to present them to you, and I will in just a moment. My name is Teresa Capitola. I'm the co-president of the Australian Health Promotion Association Victorian Tasmanian branch. My colleague Prue Steer is here. Do you want to give a wave, Prue, and a hello?
Hi, everyone.
Prue is the vice president of our branch. I would like to draw your attention to the chat. And as I said in the chat, a big welcome to everyone. This is the Victorian Tasmanian branch, but we know we have participants from around Australia. Prue and I find ourselves on the lands of the Wurundjeri people of the Kulin Nation in Naarm in Melbourne. And if you would like to add where you find yourself today, in which lands you find yourself, that would be wonderful. I had the privilege of attending the Sustainability Living Festival opening on Saturday, and Costa from Gardening Australia did his wonderful job. And he also invited people to add their names of the lands in which they found themselves. And he made this beautiful comment and said, the more that we see the names of the lands, the more that we acknowledge that we are on the lands of the First Nations people and how privileged we are to be on those lands. So I would also invite you to write the names of the lands on which you find yourself today. So to that end, I would like to do a formal acknowledgement of country, and I would like to draw your attention to this beautiful artwork we were able to commission from a First Nations artist, Mick Bogey. And this is a beautiful artwork called Land is Country, Country is Self. And you will see this if you go to the website for Victoria Tassie branch. You will see this beautiful artwork there. We were very lucky to be able to purchase this artwork, and Mick was able to not only present us with the certificate of authenticity, and of course that's very important so that we are acknowledging and respecting the intellectual property and the creative property of our First Nations people. But also accompanying the artwork is a beautiful explanation of what this artwork means for Mick. And I thought, as in terms of acknowledgement of country, I would just read it. I know that you can all read it yourself, but it's such a lovely acknowledgement of what this artwork means to Mick. So he did this artwork for NAIDOC Week in 2020, and it's entitled Always Was, Always Will Be. And he wanted us to understand that this is his way of expressing the understanding about the truth of Australia and the nation's history. He wants us to understand the importance of the historical truth-telling, and that we accept the wrongs by inviting people to listen to First Nations people's stories and learning about them and their longevity for over 65,000 years of knowledge. So I will quote directly from this particular writing: to acknowledge, accept and recognise the impacts on our First Nations people is the key to reconciliation and ensuring we all heal as a nation. It is a painting of our Australian Aboriginal and Torres Strait Islander tribes and our connection to these lands. It expresses and recognises that sovereignty has never been ceded. So again, I do encourage you to write down the lands on which you find yourself today. Also in the chat, you'll notice there's quite a bit of information. We are going to use a lot of bells and whistles today to ensure that we can engage with you as participants in this PD. So to that end, we have set up some Padlets, and if you haven't used Padlets before, here's fingers crossed that it all works. So I've put in 3 separate links to 3 separate Padlets. And when we give you the prompt, which will be after each of the guest speakers, please go in and join into those Padlets, and you have an opportunity to do some writing and sharing. So for those of you that do know how Padlets work, and because I'm an educator, I use these in my teaching, it's an opportunity to share and to brainstorm and to let us know what you're doing or what aspirationally you would like to do in the health promotion field in the co-benefits for climate and health. And then what we will do, and here when I say we, I will drag Prue into the picture, we will make PDFs of this information and we will send these out to you at the end of the PD. So I was saying to Prue, it's a bit like when you go to a party and then you get a lolly bag at the end. So your lolly bag will be sent to you hopefully by the end of the week in the form of the collective brainstorming, the collective action, and the collective aspiration of the participants here today. Now, if you are listening in, make sure that you mute your mic. And as I said, you have an opportunity to share questions in the chat after each presenter. So exactly what are we going to do today? We're going to ensure, because we are good health promoters and we are ensuring that we promote the mental health and well-being of all of us, sometimes the work that we explore can be a bit disturbing, which is a natural reaction to very upsetting information. So we know that climate change can present as extreme weather events, it can present as fires, floods, droughts, and we know that these can be very impacting on all of our psychological and mental well-being. So if you would like to reach out for some support, there is wonderful support available to us here, and some of them you can find on the screen at the moment. In particular, if you go to the Australian Psychological Association, they have the most wonderful resources, and these are important for us to use personally as well as professionally. So I would absolutely direct you to go and have a look at the Australian Psychological Association. All right, so what are we doing today? We have a full program, which is why we have started on time. And as you come in, then just be assured that there's a recording and you'll be able to catch up with the previous parts that you've missed out. So today we are going to have our first guest speaker, who is Dr. Rebecca Patrick, and she's the Director of Sustainable Health Network and the President of the Climate and Health Alliance, in addition to some other wonderful portfolios that she holds. I thought I would do the introductions now so that we'll save time and we can just move seamlessly into the next part of the presentations. After Rebecca's presentation, you'll have an opportunity as a participant engagement to also talk about what you would like to do or what you're currently doing in terms of advocating for climate change action. Following quickly on the heels of that, I'll talk for 5 minutes around the mandates and the directives that we have, and I'll speak to Victoria and Tasmania in particular to do action in climate change and health. It will then be my great pleasure to introduce Jo Brown, who is the Manager of Health and Wellbeing at Southern Grampians and Glenelg Primary Care Partnership. After Jo, you'll have an opportunity again to do your part about what does health promotion look like on the ground for you. And then we will welcome Dr. Anita Pryor, who's the co-director of NatureWorks. Anita's coming to us from Tasmania and we'll be talking about doing health promotion in nature. And then you'll have another opportunity to do your bit and share your information. Hopefully we'll have some time for questions. We have a survey to see how you found all of the presentations to date. Okay, so let's see if some of the bells and whistles work for us today. If this is not Padlet, this is Mentimeter. So as I said, we thought we'd get all the bells and whistles out, and perhaps we'll have an orchestra, and perhaps we'll have a clanging of things falling on the ground. So let's see how it goes. So in Mentimeter, you can go to your computer or to your phone and just go in www.menti.com. Now, it will ask you to sign up and to log in and to share the dog's first name. Don't do that. You'll find on the top right-hand corner a login or a code request. And the code request that we'd like you to put in is 4150724. I feel like a telemarketer. So this is your opportunity to tell us about your favourite health promoting natural sites. Now, this can be whatever you like. So it can either be the types of nature where you like to be, or that are health promoting for you. So think beaches, think mountains, lakes, wilderness, deserts, whatever. You can put in particular names of places that you enjoy. And if you have the Indigenous name, we would welcome those as well. What we are hoping to do here is create a word cloud. So between all of us, we can share our most wonderful, beautiful places that inspire and promote our health. So how are we going? Has anyone had a chance to go in and to do it? Is it working? Of course it's working. The bells and whistles are all working. So you know how word clouds operate. You have 3 opportunities, so you don't have to have your first favourite. You can have your top 3 favourites. And you can see that these are growing as we speak. Clearly, we're all looking for beaches and forests, so gorgeous. And of course, for those of us in Victoria in particular, we are almost, with our fingers crossed, almost out of lockdown restrictions. So this has a lot of poignancy for us in particular, as we are all eager to go to those natural places that give us our health promoting care and love and comfort. Okay, how are we going? We are loving those beaches, we are loving the mountains, and we are loving the forests. So gorgeous to see. So let's keep going and build this word cloud. It's wonderful how it just kind of creates in front of you, isn't it? It's just gorgeous. I'm also just checking on the chat, and I can see that we've got people from everywhere. So thank you for putting in those locations of where you find yourself today. So I'll just give you another minute if you would like to. And isn't it great? The Mentimeter works. Let's hope that the Padlet also works. So we are loving the beaches. I bet you there's a lot of people from Victoria inviting in at the moment. We are just loving those beaches, mountains and forests. Some people have put some specific places. I can see the Mornington Peninsula making a high profile here. I can see someone's just written any beach, just take me to a beach. I can see Rebecca Patrick nodding her head. The Otways, of course, Cradle Mountain, Tarrawalga National Park, Cunyon Beach, the Blue Mountains. Someone's put my garden, sounds beautiful. The Stirling Ranges, gorgeous. Okay, that's been a wonderful exercise. And what I wanted to do here is make that link between health promotion and the natural environment. Certainly our presenters will all be touching on this in different levels, and Dr. Anita Pryor in particular will be talking about nature-based health promotion. And we know that this does rejuvenate us and give us our care and comfort. Wonderful. Thank you for participating in that. Now, it is my great pleasure to reintroduce Dr. Rebecca Patrick, who comes to us from Deakin University, as well as the Climate and Health Alliance. So thank you so much, Rebecca. I'm going to hand over to you, and just let me know when you need the slides changed.
Thanks, Teresa. Hello, everyone. That activity always makes me smile, Teresa, thinking about my favourite nature spaces. I too would also make an acknowledgement of country. I'm on Kulin Nation land today, out here in the west of Melbourne, specifically Williamstown. And the name associated with that is the Yakulit Willam, which means river dwellers, so the head of the bay. I'd also like to thank the Health Promotion Association, particularly Taz and Vic Branch, for giving me the opportunity to talk about my topic. I've been looking at this topic for a little while now, climate change, nature and health promotion, for over 10 years. When actually Teresa grabbed me in the corridor for the first time and said, "Rebecca, we need to do something about climate change." I said, okay. And so I've been very focused on this nexus for more than a decade now. Thanks, Teresa. So I've got a couple of hats on today. On the left-hand side is the logo of the Climate and Health Alliance. So I'm the current president and chair of the Alliance. In the middle there, as Teresa advertised earlier, I'm the director of Deakin's Sustainable Health Network. And on the far right, I have the pleasure of co-leading in my role as a senior lecturer in health promotion, the Health Nature Sustainability Research Group at Deakin University. And my presentational brief today was to do the bigger picture piece to set up the rest of the presentations. So I understand that there's some professional development readings that have been shared, and I believe in my students, so I'm assuming everyone's had an opportunity to read through or flip through some of those materials. So I'll just give a very high level overview of the links between climate, nature and planetary health. And we look at that from two angles. So we look at the negative health impacts of climate change and environmental degradation, but we also look at the well-being aspects of connection to nature. I'll also walk you through, or perhaps it'll be a sprint through because I have about 10 or 15 minutes to talk, of a roadmap and case studies from a recent Medical Journal of Australia Vic Health solicited paper. And importantly, because I imagine that many of you are practitioners or related roles, I'll provide a couple of practice case studies to illuminate the topics. Thanks, Teresa. So a couple of foundation ideas, and I have done a couple of talks recently, and I've talked specifically about the nature and mental health connection, but I'm going to set up a different level and talk about some more health promotion related issues today. So the foundation idea is that humans depend on nature, and this slide demonstrates the overview of that nature health link proposed by Ming and colleagues, who's been looking at this along with our research group for many years now. And I'm sure many of you are familiar with this link on the health promoting benefits of contact with nature. And I think the Mentimeter was the first proof that we understand that connection at a reasonably deep level already. And so this slide shows the pathways that time in and around nature provides the wonderful active ingredients for the psychological, physiological and behavioural conditions that can lead to these multiple health outcomes. So nature provides that basket of goodies to promote our well-being. And the other piece of, or concept that I wanted to highlight was this idea of the biophilia hypothesis. And that's a theory that sits behind all of this field of work and study that explains that we are hardwired for this connection with nature, and that at all levels, physiological, psychological, social, cultural, we are hardwired for connection with nature. And indeed, contact with nature promotes our mental health and well-being. Next slide, Teresa. So let's look at it from the other direction. So that's the well-being and health side. The other part of the equation is where it goes south, for want of a better frame. So let's take a look at what happens when we disrupt nature's health promoting services. And this is what I call the context for health promotion work in the 21st century. You may have heard this terminology before, but the scientists are saying that we're now living in something called the Anthropocene. And what its number one feature is that it's marked by massive human pressures on the natural environment. And like I've said before, that's significant because we're hardwired for nature connection. And it also provides the essential resources for living: fresh air, water, food, and a relatively stable, livable climate. And in health promotion terms, we call these ecological determinants of health. And this figure here on the slide is a concept that we use to explain this to people, and that's called planetary health boundaries. And this shows the problem. We've crossed or are close to crossing several planetary boundaries, and the ones highlighted in grey that have come across our planet there are the ones that we've already crossed, and the other ones are showing that we're moving in the wrong direction. And so we're already experiencing the deleterious health impacts of climate change, atmospheric change. And what that means is respiratory and cardiovascular disease arising from air pollution. When we lose our biodiversity, we get infectious disease outcomes. And then when we disrupt our biochemistry, we mess with the soil that grows our food. So that's the two angles and the two parts of the equation. Teresa? So certainly the link between health and the natural environment has come to the fore over the last 3 years in particular. But, you know, they told us way back in the 80s that this is what we were heading for. So we're now faced with the climate emergency. And this is felt by all of us, regardless of where we lived in Australia in late 2009, early 2020, was devastating bushfires, demonstrating that climate change is real and it's urgent, and it's here for us to deal with immediately. And so we know it puts at risk our natural environment, our human health, but also the economy. And I've shown this slide before, you may have seen me in action, but for me, the image of young Finn Burns here steering away from the apocalyptic backdrop at Mallacoota really goes to you know, the reality of the environment that we're currently living in. And of course, coronavirus, an infectious zoonotic disease traced back again to human pressures on the environment, and is living in close proximity with animals, and therefore the transfer of disease. And of course, for me, the mask not only represents protection from air pollution, but also infectious disease. And of course, we're still faced in Australia with the tyranny of the fossil fuel politics, and we're still taking it to the government. And we've got a lot of debate going on with the National Party at the moment that our economic recovery should still be gas and fossil fuel fired. Okay, let's keep moving, Teresa. Now, look, Teresa's going to go over this, so I won't labour the point, but what does all this mean for health promotion? And so for health promotion and health promoters, these mandates, the evidence, the science, and various policies have been translated into local and global mandates that guide our work. We had the IUPI conference or Congress in 2019, where conference participants called on the community to urgently act on planetary health and sustainable development, not only for now, but also for the sake of future generations. The Health Promotion Journal of Australia, as early as 2011, had a special edition on climate change. And then I know that Teresa's going to talk to you more about state level policies, so I'll skip right past that. But what I want to talk to you now is the roadmap that myself and colleagues set out in the Medical Journal of Australia, solicited by Vic Health for Australia in the 2030, with a focus on ecological determinants. Thanks, Teresa. Thank you. And so this document, and I understand it was in your preliminary show bag, it sets out the latest evidence on the state of the natural environment with a particular focus on climate change. It highlights the health impacts of climate change, the challenges Australia's position as a major fossil fuel producer and exporter, and certainly, and I'm happy to call it out, a country lacking clear emissions reduction policy. Hopefully there's some change on the way there. And we also offered a 4-point roadmap for action, which I'm saying I'm going to walk it through, but I'm probably going to sprint so I don't mess up with the time frames. Next slide, thanks. How am I going, Teresa? Am I okay for time? Good. Okay, so the first action on our 4-direction roadmap was influencing Australia's actions on fossil fuel development and decarbonising the economy are not arguably, I'm not going to argue about it. They're the most urgent and far-reaching challenges this decade, and health promoters have a stake in that. As you can see from the slide, that was advocating for an urgent transition to sustainable ways of living, and a rapid decarbonisation of the economy was our first directive. The good news, though, in Australia, the health sector is highly engaged, and we already have a blueprint for this directive on this page here, and that's a national framework for climate, health and wellbeing, which, Teresa, can you pop me to the next slide? So let me give you an example of that directive in practice and the work that's already been done. I already at the start said that I have a climate and health hat, being the president and chair, but I'll use that case study because it's a national example of a health promotion organisation leading policy and advocacy work. So as you can see in this slide, our core business is to mobilise the health sector. The Australian Health Promotion Association was one of our founding organisations in 2010, and we continue to develop that and evolve our relationship. We're an alliance of many health groups, plus individual members. We have international partners, as those demonstrated on the slide. We lead a campaign called Our Climate, Our Health campaign, which calls on the federal government to develop a national strategy on climate and health. So that's the case study organisation. Let me tell you about the work. So on this slide is the policy platform for federal climate and health policy, and it's a framework for a national strategy on climate, health and wellbeing. It was presented to Parliament in 2017, and we continue to repitch until it gets up with the great policy advocacy, mediation and lobbying skills that we know health promotion can be effective with. We've just relaunched our 2.0, and this is the front page of it. And so as you can see on the slide, this is the intent, is it helps us to meet our Paris commitments, and it helps us evaluate our success over time against the Lancet Countdown. Next slide. And who's behind all this? People that work in the health sector and health organisations. Here is a gorgeous group of health professionals holding up the signs for this campaign, and a campaign that is around policy and advocacy work. So what we do at the Climate Health Alliance is train up health workers to connect with their local MP and put climate and health on the agenda. So again, lobby, mediate and advocate. I have 2 minutes, Teresa. Okay, the next slide. Direction 2, we call for a reset of health promotion frameworks. Again, the good news is health promotion, because its foundations are in a socio-ecological approach to health, we're in a really strong position. Yeah, we're geared towards the principles and the practices that are outlined on this slide. Move to the next slide. Thanks, Teresa. So again, the case study of CAHA, a national health promotion organisation. On the left is the framework that I just talked to you about in the policy. And this framework is guided by planetary health, Indigenous knowledge systems, health co-benefits and climate resilience thinking. On the right-hand side, we have another example of a program, which is Global Green and Healthy Hospitals. That we run out of CAHA, and its explicit goal is around health co-benefits for human health and health of the planet in the health services setting. Thanks, Teresa. The third direction out in this roadmap is around leadership for planetary health from the health promotion sector. And I've popped on this slide just a couple of examples of health promotion leadership in framing work that needs to be done and those that are leading it. And the first one on the left-hand side was reports solicited over 10 years ago from Sustainability Victoria and the Department of Health, who identified very early that health promotion and the way that we work is very well set up to lead this work in the community. Next slide, thanks. Okay. Oops, yeah. Okay, again, back to practice examples that relate to those ways of working is the Cooey-Rutt Regional Health Service. And the Cooey-Rutt Regional Health Service model of co-benefit planetary action is very well documented and has attracted many awards for climate resilience, leadership and emission reductions. And going to that idea, and I know health promoters are starting to say, okay, we know the strategies, but how do we evaluate this? And so Cooey-Rutt Regional Health Service has already done some evaluation work, notably with the support of Deakin, to actually demonstrate the co-benefits of the men's shed for human health and health of the environment. Next slide, thanks, Teresa. Finally, direction 4, nature-based health interventions. And I know that my colleague later in this session, Anita, is going to really drill into the opportunities for health promotion of nature-based health interventions. And I actually think this is an untapped opportunity for us as a field where we can get co-benefits for health and the environment. Next slide, thanks, Teresa. I'm nearly there. So in terms of why and the evidence that sits behind nature-based interventions, here's just one example. Sorry, it's probably hard to tell from this. This is the evidence that demonstrates co-benefits of an environmental volunteering or conservation program. So we've been able to demonstrate in a large statewide study in New South Wales that conservation activities promote health, social connection, spiritual health, physical health, and also natural environment outcomes. Finally, landing on a practice example, coming back again to Cooey-Rutt Regional Health Service. We know that their men's shed, community garden and eco house, which is co-located with their hospital, provides a setting for recovery from illness and injury, knowledge exchange, personal leadership, mental health promotion, and also sustainability outcomes. So that's a nature-based intervention and setting to promote health and wellbeing. So that's the piece I wanted to set out. I just very briefly want to say, look, this is the critical decade. Health promoters are highly engaged in Australia. We need to continue to build this momentum, and we can all contribute to this by influencing our immediate sphere. Thanks, Teresa.
Awesome. Now, Rebecca has mentioned quite a few documents and reports. The ones that pertain specifically to the Climate and Health Alliance are available on the Climate and Health Alliance website, so you're very welcome to go and visit them and have a look. What I'd like to do now is to invite you to share with us what you're currently doing in terms of advocating for the health co-benefits of action on climate and health. Now, I'm directing you to the first of the Padlets. So in the chat, you probably have to just scroll up the chat a little bit. You'll see that I've put a link in there which says, it's underneath the bit of writing that says you have the opportunity to engage in discussion, and it says Padlet PD1, and there is a link. So I'm just going to share my screen and let's see if we can all wander over to that particular Padlet. So this is what I'm seeing, and I'm hoping this is what you're seeing on your screen if you go to that particular link. So there are two titles here. One is, as health promoters, what are you inspired to advocate for in terms of climate action health co-benefits, or what are you currently doing in terms of advocating for climate action and health co-benefits? So this is the springboard from Rebecca's presentation, which had a focus on the advocacy work of the Climate and Health Alliance. So we want to share here, we want to hear what you're doing or what you would like to do. And again, this is a way of using our health promotion techniques of using a strengths-based approach to come into our community and say, what are we all doing or what would we like to do? So if you have an opportunity, you can start to add here things that you either aspirationally would like to do or are currently doing in terms of advocating for action on climate and health co-benefits. So I can't see that we've got anyone adding at the moment.
I'm not sure that link was shared, Teresa.
It's the link is in the chat, and
yes.
So you have to just scroll back up, unless Prue, you can quickly add that link.
Apologies, Teresa, but if we've joined late, the chat will not appear for us if you posted it at the beginning. So reposting those enables us to see it for those of us who've joined later.
No worries.
Thank you so very much.
I can do that really, really quickly. Prue, do you want to do it, or do you want me to do it quickly? You're on mute, so I can't hear you.
There we go. I'm in the process of doing it. I'm trying to share it to all participants. So hopefully this one works. It just says it's going to Arabella at the moment.
Oh yeah, where it says 2 at the top, just scroll up and you'll get to everyone.
Oh, here we go. Great.
That's wonderful. Okay, so now you can see that link. Thanks everyone for that feedback. I did forget that about people coming in late. So let's see how we go. And again, what we're wanting to do is to share as a collective of activists, health professionals in the sector. And as I said before, if you're inspired by the work that Rebecca has mentioned from the Climate and Health Alliance, or if you are currently doing work, we'd love to hear from you. And I assume everyone can see this particular beautiful ocean. This is one of our lovely aspirations from the Mentimeter. So Prue, you can just give me an okay that you actually can see my screen and can see that we've got the ocean there. Yep, and now I can see that we're starting to get some feedback. Wonderful. And I love that first one that's come up about what you can do, because we can certainly go to our professional sector, and we can certainly go to our personal spheres of influence as well in order to get action happening. All of those are important. So I can see that we've got some people who've completed some formal training. So I'll give you a few more minutes. Oh gosh, so many fantastic things. The other thing that you can do, of course, is that you can like other people's comments, and that will help us if you want to do a quick shortcut. If you don't want to type everything and think, I'm doing that, or that's what I would like to do, then you can just like other people's comments as well. And this will help us again when we put this together as a PDF and send it out, so that everyone knows, you know, this is where the interest is, or this is where there's a lot of action already happening. So make sure that if you don't want to particularly put in what you're doing or aspirationally what you want to do, then you can also like other people's comments. Someone's put not so much inspiration as desperation. There's the quote of the day. And wonderful, yeah, so people talking about working in their own time. And I'll talk about the directives that we have available to us as health promoters in just a minute. But some wonderful contributions here about being inspired and wanting to do some action, and then so much information here about the promotion that's actually going on already, especially in the food area, because we know that there are synergies between promotion of healthy eating, obesity prevention, and increasing physical activity. So there's lots of really good synergies between some of the existing programs and action on climate change. All right, now you can keep going on that, but I'm going to stop sharing because we need to move on and onto our next presenter, which is me. Oh, goodness gracious me. So I'll just share with you back to our PowerPoint. So as I said, lots and lots of movement happening. And I'll just make sure that you can see my screen. Yep, Prue, everyone can see the screen, and we're back to the Padlet. Yep, awesome. All right, so I would like to do this very quickly, and I would like to direct you as to where you can get information to pursue perhaps your own internal advocacy that you might have to do within your organisation to ensure that you can take action on climate change. Now, my area is Victoria because I'm here in Victoria, and as I teach, I tend to focus on Victoria. So I'm not that skilled up on Tasmania, but I have got some information here as well. Now, Rebecca mentioned, and Prue has put into the chat, that we've put some pre-readings as part of today's professional development. And so you can go into the Australian Health Promotion Association Victorian and Tasmanian branch into our resources, and you will find, I think, 5 or 6 documents that we've put up there. Some of them may be familiar to you. For example, the Victorian Public Health and Wellbeing Plan. And Rebecca immediately went to that in her presentation because this has been a game changer here in Victoria. When the new Victorian Public Health and Wellbeing Plan came out 2 years ago, the 10 health priority areas included climate change. And not only is climate change one of the priority areas, it's actually one of the 4 focus areas. So we actually have a very strong mandate in Victoria to take action on climate change. So if you are working in this sector, if you need to advocate to your own organisation about why you should take action, well, here it is, it's in the Victorian Public Health and Wellbeing Plan. The other thing that we have available to us, and I'm ever grateful to the Department of Health and Human Services, which has recently changed its name, for the document that they've put out called Tackling Climate and Its Impact on Health through Municipal Public Health and Wellbeing Planning. So as you know, our local governments are required to report and develop a plan every 4 years on health for local government. And this is a fabulous document which steps you through the actions that you can take on planning for climate and health co-benefits. I've pulled out one of the images here. I'm a big fan of infographics. So immediately you can see here in this beautiful infographic, the links between taking action on climate change and taking action on health. And you can see that if we want better mental health, lower rates of cancer, fewer deaths from extreme heat, pardon me, lower rates of obesity and etc., then the actions that we take on climate change have those co-benefits for health. We also have in Victoria the Climate Change Act, which was initiated in really back over a decade ago, but was renewed in 2017. Now, the Climate Change Act provides Victoria with the legislative foundation to manage climate change risks, maximise the opportunities that arise from decisive action, and drive the transition to climate resilient communities and economies with net zero emissions by 2050. So this is a really important act. So if you're looking at, and again, if you're looking for funding, if you're needing to put things into your funding applications for money, for grants, for your action, for your health promotion plans, put in the Climate Change Act, which tells you you have the legislative requirement to act on climate change. Our Public Health and Wellbeing Act has served us very well and is picked up really well in tackling climate change and its impact on health, that Municipal Public Health and Wellbeing document, which says between the Climate Change Act and the Health and Wellbeing Act, we do have the mandate to take action on climate change. Now, for those of you in Tasmania, I've picked up that your Tasmanian Premier, Peter Gutwein, is very keen on conservation and has put into place some policies to take action on for conservation. And I draw your attention in particular to the document below, which is the Hobart document for Hobart around conservation. Let me go to my next slide. Now, these 3 documents we've put into the ARPA directory. So if you go into the Victorian and Tasmanian branch, these are some of the resources that we've put up. The glossary on health and climate change, everything you ever wanted to know, what do all the terms mean and what do the acronyms mean, are all within that. And we can thank the good folk at the Climate and Health Alliance for putting together this glossary. The article that Rebecca talked about on the roadmap for health promotion that was commissioned by Vic Health and appears in the Medical Journal of Australia, we've also put up, and you can see it in our site. And this further one by the Climate Council is a fabulous document for those of you working in local government and wanting the information and the actions for climate change. So there you are. You have the directives the mandate, and the documents that support action on climate change. All right, how are we going for time? We are doing okay. We're just a little bit over, a tiny bit over time. So I mentioned to you that Jo Brown is joining us from the Southern Grampians and Glenelg Shire and is the Manager of Health and Wellbeing at the Primary Care Partnership. Thank you, Jo, and welcome to the presentation.
Thanks, Teresa. Thanks for having me here today. I'm just really excited to be here amongst some pretty amazing people. I've certainly spent some time with Rebecca and Teresa over the years, so I'm really excited to be able to share our work with you today. So yeah, my name's Jo Brown. I work as Manager Health and Wellbeing for the Southern Grampians and Glenelg Primary Care Partnership, which is located in the southwest of Victoria. I'm located in Hamilton in southwest Victoria, and I'm on good Didjamara country, and I'd like to acknowledge the custodians of the land on which I'm standing today and pay my respects to their elders past, present and emerging, and any Aboriginal people joining us today. So I'm with the PCP, Primary Care Partnership. Currently, we're funded through the Department of Health. Some arrangements are about to change, but we won't go into that now. There's certainly not enough time to talk about that. But certainly we work with 20 partner agencies, they're health agencies, community sector agencies, working together to empower communities to thrive. Next slide, thanks. Oh, sorry, yep, no, I'll keep with that slide, Teresa. So our journey today, when Teresa asked me to present today, I tried to consider what you would want to know as a health promotion practitioner. First, I thought about the lessons for new players, like what would I want to know if I was starting this journey, what I wish I knew when I began. And then I thought that, well, our story actually grew from the learnings over each time. So maybe the mistakes we've made, some of the side steps, maybe the backward steps, even the forward steps have actually helped us reach the destination where we are today. So what I'm going to do today is share with you the journey along the way. And I'm going to pause to consider what we learned at every stop and then what changed and what was new. Thanks. Next slide, Teresa. So, you know, climate change was emerging as a health issue about 15 to 20 years ago. And I guess now we wouldn't say it's an emerging issue, rather it's an urgent issue. And the work that our PCP has been doing has highlighted the value of PCPs as a leadership platform and the community and health sector's role as having really significant roles to play enhancing the resilience to climate change adaptation. So why did we begin working in this space? Probably like we're even having these conversations today. You know, we know that climate change exacerbates disadvantage, and those who are the most disadvantaged are those who are more vulnerable to the impacts of climate change. It's widely recognised that disadvantaged groups have poorer health compared to communities of higher socioeconomic advantage. So climate change is only going to amplify this. And this quote from as far back as 2009, that was in the World Health, some World Health Organization research by Costello and his team, is quite dramatic. You know, under climate change, the wealthier parts of the population will become inconvenienced and the poor will die. And I think when I first read that quote, I think, oh, that's really a bit over the top. And then we had the heat wave of 2009, where 374 excess deaths occurred in the state of Victoria alone. I thought, yeah, that rings true. Next slide. Thanks, Teresa. So we started working in this space about 13 years ago. And at that time, though, all those different policies and frameworks you just showed us, Teresa, they weren't really around back then. So we had to sort of go it alone a little bit. And I've just mentioned some emerging frameworks, which I don't need to do now. Next slide. Thanks, Teresa. So back in 2008, as I said, there was not much out there to help us. And what happened was the partners from our PCP attended a conference that actually might have been a health promotion conference, and they came back asking questions like, what do we do about climate change and health? What's our role? You know, is the PCP going to guide us on this? And our response as a PCP was, well, we'll just wait. You know, we'll get some guidance pretty soon from the Department of Health, or others will let us know what to do. So we paused and we waited for a little while. We got a bit impatient because nothing was happening. Waited again, and then we thought, no, there's nothing out there. So what we did is probably what all good health promotion practitioners do. They get everybody in the room and they workshop the situation. You know, what do we know? What do we know locally? We've got a lot of knowledge in this room. We'll get a great facilitator in, And with our combined expertise and knowledge, we'll try and figure out what climate change and health actually means to us, particularly for our local community. So because of this, and I can't take any credit for this because I wasn't around in 2008 in this role then. Because of this courage, I suppose, and innovation, the resultant was this publication, Climate Change Adaptation: A Framework for Local Action, which we fondly call the Blue Book. I sort of call my security blanket at the beginning, but we'll call it the Blue Book, so that's a little more professional. Next slide. Thanks, Teresa. So the Blue Book considered the context, health promotion principles, and for us, we're a rural community, so some of the rural issues. The focus was on vulnerability and that those most vulnerable were likely to be impacted, a la the Costello quote. And the Blue Book identified 5 everyday impacts of climate change and built a framework for action that was based on the Ottawa Charter alongside these everyday impacts. And those impacts are here. The things like household energy use, household water use, food security, transport and community connection. Looking back, I think they're actually quite abstract things to be thinking about. There wasn't really a lot of talk about extreme climatic events, but that was to come a little bit later. Next slide, thanks, Teresa. So then in 2008, I was employed for 3 months. It's a long 3 months because here I still am in 2021. To look at how the Blue Book translates into action. And that started with a trial in a small country town, which later became a project that was really innovative called Pass the Parcel. And I certainly don't have enough time to go into that now, but it was a bit of a starting point for us. And then that project was followed by a number of other discrete projects, and they were all aimed to increase awareness and capacity around what is our role around climate change and health. But we had to focus it on those sort of 5 things, the everyday impacts. And so we found ourselves really focusing on household energy efficiency, heat wave, and food security. Next slide, thanks, Teresa. As I said, I'd stop and pause and think about, well, what did we learn from that first piece of work? So developing that Blue Book was just pivotal. It began to build our understanding, and we couldn't wait for that advice from anybody else. So we just had to cross our fingers and back ourselves, really, and just start moving forward. I think that started to build some local capacity and understanding, at least get some conversations happening. The everyday impacts that were identified in the subsequent work around household energy efficiency created relevance, particularly with reference to heatwave in 2009. So we were able to talk about how climate change impacts most vulnerable people in our community by actually using the situation that was around us. The language and communication always presented challenges for us. We made a few deliberate decisions early on. Southwest Victoria is a very politically conservative part of the world. So we weren't brave enough to say the C words much back then. We didn't say climate change. But we made a decision we weren't going to be climate change educators. We weren't going to get into debates about climate change. But what we were talking about were the impacts. And in fact, it didn't really matter that we weren't talking about climate change because we did some social network analysis research within one of our projects. And within that research, we asked people to self-assess their level of climate acceptance or climate change deniers. And what we found, actually, one project is the biggest client denier was the biggest project advocate and champion. So the relevance for him was about comfort, health, home. It wasn't actually climate change. So we acknowledge we're in a learning phase. We didn't need to know everything. I often refer to myself as the sponge, ready to soak up anything but not everything. We knew we needed to seek partners to help us, and they weren't always going to be our traditional ones. And we wanted to be open and honest about what we knew and what we didn't know. Next slide, thanks, Teresa. So around 2014 was a light bulb year for us. We started to move on from that project-based approach to try to be a little bit more strategic. And I think we needed to do all those projects first in order to get to that point. So this happened mainly through some relationships that we developed along the way. We reached out to people who might be able to help us to start to think tank our next steps. And one of those people who we reached out to invited us to a forum that was the Victorian Centre for Climate Change Adaptation Research Forum, because he thought we might be interested in a little bit of research. So total trust in this person. We just met them. They were talking our language. They said, come along to the VicArth Forum. So off we went to a forum. Actually, we snuck in because we couldn't afford to go. So he snuck us into the forum. And then we went to the research session that he thought we might be interested in. And they're talking about adaptation tools. And I thought, I don't even know what this means. The language wasn't really exciting me. And then up on the screen pops our blue book during the presentation. So immediately I thought, well, you guys are all right. I want to work with you. And a partnership was born. And I think participating in that research with Victorian Centre for Climate Change Adaptation Research Centre, we started to think a lot more strategically. And what it did was it led us to do facilitate a number of strategic projects. And we had to seek external funding for all of these. We're core funded through the Department of Health, but they didn't fund any of these. They didn't sort of see this within their remit. We had to get some external funding. But what it started to do was understand the role of the community and health sector and expose the value of PCPs. So there's just screenshots of four pieces of work that we did, and they're available on our website under projects, and there's some others in there. Next slide, thanks, Teresa. So as I said, these were pivotal years. I mean, building those relationships and trust was just uncovered everything that we needed. If we hadn't connected with a guy called Thomas from the Department of Health, we wouldn't have gone to the Vicar Forum. If we didn't go to the Vicar Forum, we wouldn't have become part of that research and connect with others. Similarly, a little bit earlier, if I hadn't connected with people like Teresa and Rebecca and was part of a publication that I think Rebecca showed earlier, we wouldn't have understood the value of partnering with the research sector. And, you know, we've had this ongoing relationship with all of these people now over time, you know, since 2009. That's a pretty long time. So the role of our PCP and any other partnership platforms really started to look at, you know, how does our sector work with some of the most vulnerable people in our community? So as a PCP, we build the capacity of our partners and agents and others. And the people that we work with, the agencies we work with, they've got the closest relationship with those most vulnerable in the community. The other thing we learnt too is that we needed to document the work we did. And I don't know about you as health promotion practitioners, but we're pretty busy going from one project to the next sometimes, and we just do not have the capacity to always document what we do. And having a research partner really ensured that we could do that. Next slide, thanks, Teresa. So, you know, we did heaps of work since 2008. It's 2021 now, it's a long time. So why is it still hard for us? It is getting easier, I have to admit. But why, for example, as one of 28 PCPs in the state of Victoria, we're one of the few that have a focus on climate change and health. So there are others doing some absolutely amazing work, don't get me wrong, around climate change, but there's not many of us. So, you know, there's still some challenges. Whose role is it? Is it the state sustainability officer's role? Is it an environmental role? Is it a district nurse's role? Where's the guidance here? What language, you know, do we use? Sometimes it can be a little bit off-putting when people are talking about adaptation and mitigation. If you're the health promotion practitioner, what does that all mean? How do I make it relative to our job? Is it going to be something extra I have to do? What capacity have I got? How can it be embedded in the work that I'm doing? How can it be more coordinated? You know, we don't want a siloed approach to this. We want it to be a bit more coordinated. Next slide. Thanks, Teresa. So more recently, we started to use what we'd learnt from our work in obesity prevention to develop a systems approach to climate change and health. And I'll just really quickly talk to you about a recent piece of work called Primary Care Partnerships for Community Resilience. What we did is we worked with 3 PCPs and we used some of this systems thinking approach. So essentially it enabled the focus on developing a shared understanding within the local context. So we used community-based systems dynamics approach and specifically a tool within that called group model building. After developing some readiness and understanding the local context, group model building workshops are facilitated and the participants start to identify, well, what are the contributing factors to the problem and how do they interact and how do they connect with each other? So, for example, you know, what are the factors driven by climate change that impact the health and wellbeing of our community? Then enables the participants to see themselves in the system, which enables them to drive action. And yeah, it's an absolutely incredible process. It's way too big for me to go into today, But if you want to have another look at projects like this, you can have a look at our website under the projects section. Next slide. Thanks, Teresa. So using this systems approach has been another light bulb. So we had lots of light bulbs along the way that have helped us to navigate some of those challenges. You know, as we know, climate change in health is really complex. Understanding all the impacts, whose role, all that stuff I was talking about before. And what we found by using this process is that people developed a shared understanding. And they were able to then see themselves in the system. We had some people that came to the workshops that we ran who thought they didn't have a role to play. They didn't really get the, you know, how climate change and health came together. And then by the time they left the workshop, they were telling me about all the actions that they're going to implement and how they're going to go back to their team and do all this work. This type of approach is very place-based and it's very context-specific. You can't just create a system somewhere and drop it into another context. You need the people with the understanding of the concern or the problem to build the map. Next slide. Thanks, Teresa. So where we're going from here, where's our next road trip? So we've got a broader focus, not just around climate change, but also around community resilience, which will include climate change for sure. We'll continue to focus on building the capacity of the community to be community-led, and we'll continue a focus on partnerships and collaboration, because we know a siloed approach just does not work. Last slide, thanks, Teresa. So feel free to reach out to me if you've got any questions, comments, thoughts, ideas. I'm more than happy to answer any questions. Thanks heaps. Ta.
Thanks so much, Jo. And you would have seen, we really are incredibly lucky to have this retrospective look at how progressive the Southern Grampians Glenelg PCP has become. And it's been through, as Jo has said, through necessity and also in the face of a lot of resistance. And it's been wonderful, Jo, to get that perspective. I'm just wanting to say, George Crisp, if you could turn your mic off, because we are just picking up some sounds from you, that would be wonderful. Now, I'm going to hand over to Prue, who's going to whiz you off into the land of Padlet. Thanks, Prue.
Thanks, Teresa. So I've shared the Padlet link again, just in case those that joined us late aren't able to see that. So you should all be able to click on the Padlet link. So it's PD2. Okay, and so now you'll be hopefully looking at the Padlet screen and hoping that you can tell us about your health promotion in action, so what you're doing or inspired to do. And yeah, just, or even if it's aspirational, so what you'd like to do, or you could like others' comments, but if you can just start to jot down your comments there, that would be great. We're keen to hear what you're doing or would like to do. Great, good. Well, that's fantastic. Good, like to hear that. Keep learning. Okay. And like Teresa mentioned earlier, that we'll be capturing this information and sending it as a PDF following today's event. So any comments you can add, it is great to be able to share and hopefully implement yourself. But it'll be your lolly bag to take home. Fantastic. Sure. Good. It's great to see everyone contributing. I'm just sharing the link again, Arabella. Wow. Lots of different comments and ways that you're contributing. Fantastic. Fantastic. Okay. Okay. All right. Well, I might just stop you there. That's lots of different comments, which is lovely to see. I think we'll just keep moving now in the interest of time. And we have, I might hand it back to Teresa actually to introduce Anita.
Thanks so much, Prue. That was fabulous. I saw people that are setting up wetlands, people who are doing ride to work. What you'll find when we put all that information together is how inspired, if you're not already, to take action and perhaps ideas. It was wonderful. Not only did people put likes, they also made comments about what they would like to do and affirming the work of other health promoters. That's fabulous. Okay, as we move along now to our final speaker, this is Dr. Anita Pryor, and Anita comes to us from Tasmania, and she is the co-director of Nature-Based NatureWorks. And Anita, great to see you, and I know you've got some fabulous slides to share with us, so I'll hand over to you right now. And just let me know when you'd like to change the slides.
Thanks, Teresa. Hello, everybody. Hello, health promoters around Australia. Really good to be here and contribute. And yeah, if you jump to the next slide, Teresa, I'd like to acknowledge I'm in Nipaluna, which is Hobart, on the land of the Murawina people who aren't around, and I pay my respects to their elders past and present and emerging, and the incredible Tasmanian Aboriginal community that's doing such great work to care for country still today against the odds. This little list here has me acknowledge and respect an Aboriginal elder, Tex Scewthorpe, who wrote a book, Treading Lightly, I've got here somewhere. But he took us on a 10-day walk through country to hear a story, and he said, and it sunk to my bones, if I can look around and recognise food, water, shelter and medicine, then I belong, and if I can't, then I'll need some help to live there. And so I bring that idea to this talk as well. A little bit about me, if you jump forward, Teresa, to the next slide. I come from an area that's now called Bush Adventure Therapy. It wasn't anything like that. It didn't have a name when I was entering into it in the early 90s, but it became a thing as we put together research and evidence, and as we came together as a community of practitioners over the years, and to formalise the Australian Association for Bush Adventure Therapy in 2008. And it's a pretty broad definition on purpose. It's very inclusive of diverse nature-based health approaches. And from a PhD I did in 2009, it tends to be used in early intervention, but has also got a health promoting element throughout, as will become clear shortly. Teresa, if you jump forward, Bush Adventure Therapy, you would be forgiven for thinking it's just for young men and boot camp style, and it does work really well with young men, and it can be remote, but it also, if you flick forward, Teresa, can work really well with young women, with mothers, with families, and Aboriginal men and communities as well. So it's been used with a range of target groups, almost any that you could come up with in your mind: drug and alcohol, mental health, early school disengagement, police who are showing early signs of trauma from highway patrol work, to give you a few examples. If you jump forward again, Teresa, theory and research building over the years has led us to think that there's 4 mechanisms of change at work within bush adventure therapy. The physical adventure brings your body into the experience. The intentional conversations and psychological safety net provides that mental emotional safety and therapeutic intent to the work. The social relationships bring the social cultural interactions and pro-social relationships to the experience, and then contact with nature brings an essential piece as well. And the outcomes can match that breadth of inputs by bringing out biological benefits, psychological benefits, social benefits, and what we call ecological benefits, which includes spiritual and cultural benefits as well. So if you jump forward, these practices can be done badly, and harms are possible, but at the moment we've got a really strong collegial approach to self-regulation, if you like, in informal ways. We meet annually, we share practices transparently, and we try to keep learning together. But we're conscious as well of both perceptions and also risks in that field of practice. If you jump forward again, Teresa, I'm wearing lots of hats today. I wasn't too sure which to use, so I thought I'd put each of these 3 hats on briefly today. Yeah, I'm a director of AdventureWorks Australia. I'm leading an Outbush on Country project here in Tasmania, and I'm co-leading the Outdoor Health Initiative of the Australian Association for Bush Adventure Therapy. And I've included a little, what I hope will be a nourishing video next up, to just walk you through and give you a flavour and a feel for nature-based health practices in action. Hopefully it's a break from looking at me or my slides as well, but I'll talk as we walk. If Teresa, you're able to get the video up, and if it works, press play. And yeah, here we are in Lutruwita, Tasmania. We're walking through the bush together. Come and walk with me, and we'll experience a bit of nature as we walk and talk. It will feel different to counselling in a room, or psychotherapy, or even healthcare, probably, if it's delivered out of doors. It brings us into ourselves, our natural selves, our human nature. It's a shared invitation. It's a different role and relationship between therapist or counsellor or practitioner and client or participant, but it's pretty similar, the invitation to me and to you as we walk. We share responsibilities. I might have different responsibilities to you, but we have similar responsibilities as we walk and talk. We have time, perhaps a bit longer than in a counselling room. There's a bit more ebb and flow and a bit more space. There's neutral spaces. There's an equality here together. And there's external stimuli. There's things that draw our attention and maybe give us a sense of fascination or awe as we walk. We have different interactions. It's probably a bit less formal, maybe a bit more non-verbal. Maybe we're side by side. It's a shared human experience. In this sort of way, in nature-based health practices, nature might be the setting, the place, the clinic. It might be bodily felt. It might provide sensations to work with. It might provide metaphors or lessons, insights, ideas for us to chew over. And it might even be a co-therapist to the therapist or to the participant. And for me, Anita, when I'm working with nature in a walk and talk counselling approach, I'm consciously letting nature in and noticing nature and trying to include nature in the process, both for the health and the well-being and any healing that wants to be discovered in the session as well. So there are physiological pathways that we can gain benefits. There are psychological pathways that we can gain benefits. And there are cognitive and social pathways that we can gain benefits from nature-based health practices. And I won't go into the research on all of those areas, but there's a proliferation of research and evidence across those mechanisms or pathways that provide benefits for people participating in nature-based health practices. Thanks, Teresa. That seemed to work in a jolty kind of way. So if we could go to the next slide and the next one. Just give you a quick skim of AdventureWorks Australia, and we deliver services and programs. We provide training and supervision for practitioners. We do research and evaluation, and we open up to what partnerships might be invited from others. Next slide. Sorry to be racing through. I think we've got a lot here I'm conscious of, but just to share some research and evaluation there. We delivered in Victoria for 2 years a bush adventure therapy service for women and their children who have experienced family violence, and evaluated that program, and through Berry Street services have contributed to several pieces of research work. The one on the right, outdoor adventure interventions for young people and adversity. It was a literature review focused on the impacts or outcomes of bush adventure therapy for young people who have experienced severe early life adversities and trauma. And the report on the right is about a Victoria Police program, a pilot we ran, which supported police officers to think about their mental health and consider supporting mental health of their colleagues in the workplace. And they were starting to show early signs and symptoms of trauma from highway patrol. And this pilot demonstrated benefits across biological, psychological, social domains of wellbeing. So next slide, thanks, Teresa. We deliver practitioner training, and this course is it's just begun in Tasmania. It's teaching counsellors and therapists how to take their work out of doors. And we'll be delivering one in Victoria next year, another one in Tasmania. The reason we're doing this training is because we find the biggest constraint to offering more of these services is the lacking of trained and ready practitioners. So next slide, Teresa, thanks. This is a Victorian service that we deliver at the Collingwood Children's Farm. It had a good amount of funding. It's now dwindled to bare bones, but it's continuing through the goodwill of the women participants who gain so much from the program and want to give it back, and they're volunteering their time to co-lead or co-facilitate weekly catch-ups at the Collingwood Children's Farm for women who have had similar lived experience of family violence and their children, with some support from us. We're still contributing volunteer time to keep that going until we can get some more funding. Next service is in Tas. We're delivering Adventures for All, and it's really come from the need and the demand or the interest from NDIS clients and people with NDIS plans who are looking for something other than talk therapy indoors, and they're looking to connect with others. So we're just building that up based on what people are telling us that they want, and that seems to be going well with increasing demand. And again, the need for practitioners to deliver that service is ever present. Next slide. To focus on this project for a moment, the next slide will give us a picture to look at. This came about last year when the Tasmanian government got into trouble in the hot seat over sending young people to the Northern Territory Outback program called Brahmini, and we led a collaboration of about 65 professionals who gathered fortnightly, then monthly, to advocate for the establishment of a service here in Tasmania that could meet the needs of Tasmanian young people without needing to send them far, far away to provide the health and healing that they needed. And the project has been going for a year, and we're just beginning to take referrals. We haven't got government funding yet, but we've got some olive branches of support. And just last week I mentioned to Teresa a great phone call that it still makes me happy thinking about it, that a senior bureaucrat in the Tasmanian department who's responsible for this group of young people rang and said, we're going to be putting out tenders to invite applications for development of a business case for a model that would do this job in Tasmania. And we're letting you know because we know you're interested and we'd expect a submission from you. And so that, not often do you get the phone call from government. That was a win. But the second thing she said, I think you'll all appreciate, was that based on the feedback that they received from children and young people to their consultation process on a child and youth wellbeing framework, they've decided that they need to add a 7th domain of wellbeing to their already comprehensive and impressive child and youth wellbeing framework, and that is environmental wellbeing. That young people and children told government that nature's so important to them and the environment's so important to them that it's a core part of their wellbeing. And so that's a policy adaptation that's being implemented in Tasmania, and it still makes the hair stand up on the back of my neck just thinking about that, actually. So great news. Yep, thanks, Teresa, you read my mind. And just to touch briefly on outdoor health and outdoor healthcare initiative, which is a working group, a volunteer working group of the Australian Association for Bush Adventure Therapy, because bush adventure therapy is just one of about 30 approaches that activate nature for health and well-being. You see here equine therapy, green prescribing, animal-assisted therapy, horticulture therapy. We've even included forest schools there that are starting to emerge for ameliorating sort of mental health and behavioural issues. Next slide, Teresa. Thank you. And so when we step back from the bush adventure therapy world and look at nature-based health practices in health promotion, we see that this wide suite of nature-based health interventions span prevention right through to early intervention, treatment, continuing care. Because of the role of health promotion in all of these practices, whether you're working in one or the other quadrant, you're doing health promotion work. It's physical usually, it's social usually, and it often has to do with nutrition and sleep and the range of psychological needs that people come with. The next slide just tells us, I guess it provides a little conceptual framework how we have seen this in relation to public health, that perhaps outdoor healthcare has got the focus on the prevention and the keeping people well side of the work, and outdoor healthcare might be for those with a targeted need and early intervention treatment area of work. But these ideas and concepts we're watching them, they're germinating. The interface with social prescribing, nature prescribing, and public health benefits of nature in all settings and contexts now is coming into play. So it's a fun area to be involved with. It's growing. And Teresa, I think there's maybe time-wise, should we just move slowly through this? That's where we've landed with outdoor healthcare at the moment, through to a little look at the outdoor healthcare website. I'll point you to, we're doing some research for those research nerds amongst us. We're setting up a randomised control trial to compare indoor counselling with outdoor counselling. That's a work in progress with the project team here in Tassie. And next, yeah, thanks, Teresa. We've set up an outdoor health service directory to connect people, medical practitioners, GPs with nature-based health services. And we've just been told we've received a grant from Department of Sport and Rec in Victoria to build this into a platform that's more engaging, interactive, and have it populated through promotional efforts. Next slide. sorry to rush everybody. I'm just conscious of your time as well. And I've put too many slides in here, but we got to the last slide, which I really want to tell you about, which is an outdoor health symposium that's coming up on November the 3rd and 4th. So not, what is it, 1 week away. And a great chance to get connected with 30 presentations on this area of work and leading research, leading practice, Indigenous approaches, emceed by our friend Costa Georgiadis. So he'll keep us all awake if no one does. And you can view recordings for up to a year later. So the low price, we've kept it low to keep it accessible to anyone. And if that price is a problem, we'd want to negotiate and provide a price that's affordable. But you can have access to the recordings for a year, and hope you can make it. And I think that's it, Teresa. There you go, a bit more info on that. And the contact for me if you want to get in touch. And there's I think a 30-second video if you need some nourishment now or later. Feel free to skip that, Teresa.
Thanks so much, Anita. It was lovely to go on that first walk. It was absolutely beautiful. I am just looking at the time and wondering, we've got about 5 minutes. So I'm just wondering whether we maybe not do this last Padlet and just go into opening up some questions. And I can see someone's just already posted and said, what inspirational work. So Anita, that is wonderful, and it truly is a breath of fresh air in every possible sense of that phrase, of bringing in new perspectives for health promotion, reaffirming perspectives for health promotion, and showing how it can work. So how wonderful to see all of those things. So we do have 5 minutes left in our session, and we did want to give you this opportunity to tell us about your nature-based work, but I think that some people have already been putting things into the chat. If you do have some nature-based work that you are doing, please put it into the chat and we will capture that and also put that in as a PDF as part of your package that you get at the end of this. Thank you, Prue. I know you've put in the Padlet, but we won't have time to go into the Padlet at this stage. So if I go on to our final slide, and I'm just seeing someone's just written they're from Enliven in Victoria. Welcome, Heather. So we've had a cornucopia of presenters today. So a rich, bountiful set of presenters. So Rebecca Patrick, who spoke to us from the strong, powerful, decisive and leadership work in advocacy for climate and change at a national level. And of course, they are also operating at an international level. We also heard from the reflective story, which is so valuable to those of us who are in for the long haul or have just entered into the realm of climate and health, from Jo Brown at Southern Grampians and Glenelg Primary Care Partnership. And Jo gave us those light bulb moments, and I'm sure that they were renewable energy light bulbs, of how she has learnt along the way and where the journey has taken her, not to mention the gems that she presented to us. And of course, we've gone on a beautiful nature walk with Anita, who's taken us metaphorically through the journey of coming to bush therapy and its place in health promotion, as well as literally as we went through that beautiful bushwork walk, that bush walk. I know that Prue is going to put in the link to the evaluation, and so we just want to know, did we do a good job? Did we hit the target for what you want in a PD? Are there any questions that you would like to pose to our wonderful panel of speakers? So we've got some wonderful feedback I can see on the chat, which is just lovely, and I hope our presenters are looking at the chat as well. Just a reminder that if you would like, if you're not a current member of the Australian Health Promotion Association, you can use this offer, and I do feel like a telemarketer, you can use this offer with the code, which I think says Event 2021, for a 30% discount into the Australian Health Promotion Association. You don't have to be a member of AHPA to go onto our Victorian and Tasmanian site. our branch site and to access those documents that we've put up there. We've got a chat asking for the resources again. So the resources are available if you go to the Australian Health Promotion Association, to the Victorian and Tasmanian branch, and you can navigate your way and you'll find the resources in there. The speakers have made available their email addresses, so I know that they are available and very generous to answer any questions that you may have. Prue, did you want to add anything?
Sorry, no, Teresa, no, just to thank everyone for coming, and I do hope you've all found it informative and can take away some things to use in your own work.
Fabulous. Right, so lots of thank yous, lots of inspired comments in the chat, and as I said, we will capture that chat and put it into our PDF as well. And Prue, are you able to put the evaluation link in, or has that gone in? Or
I've put it in already, but I can reshare it again if that helps.
Yes, I suppose I'm just seeing so many messages going up. Yes, so if you do get a chance, we do want to know whether we've hit the mark in this PD and what you'd like to see in further PDs as well. Just have a quick look at the participants. If anyone does have a question, we probably have time for one question. If anyone could put their hand up, and then I'll have a look and direct you to the speaker that you would like to speak to. Anyone in particular? I'll open it to any of our presenters if you would like to have any final words.
Well, thanks, Teresa. Thanks, Prue, for organising a wonderful session, and really just keep going as we were. I know a lot of great health promotion action is already underway in the sector, and I just want to acknowledge the incredible effort that's already underway. So thank you very much. I've got to drop off. Thank you. Bye.
Thanks, Rebecca. I know, Jo, would you like to say something?
Oh, just thanks again for having me today. It's a privilege to be amongst such prestigious speakers. I've learned a lot. Thanks.
Thanks, Jo, and thank you for the longevity that you have that has enabled us to see the amount of effort that it takes, and also that lovely saying, we stand on the shoulders of giants, and also we flourish. You know, when you plant a seed, we flourish from the growth of that. Anita, you've got time for last comment?
Yeah, just a big thank you from me for the opportunity to health promotions in my heart. I think in everything I do, whether it's practice or research or policy advocacy, and yeah, it just makes me take a deep breath, the thought of health promotion. So I appreciate your work and everyone's work around the place, and go well.
Thanks, Anita. So again, thank you to everyone for participating, for staying for the long haul. And as I mentioned, we will capture the Padlet information as PDFs, and also the recordings will be available, as well as the chats. I know there are people who've been talking to each other along in the chats and also wanted to link up in with each other. So we'll have those available. So again, thanks everyone, and have a fabulous day. Hope you can get out for a walk wherever you happen to be today. And Prue, we might have a stay on and have a quick debrief. So thanks everyone again. So you can probably stop recording whenever you want, Prue.